Hi everyone. In this presentation, we're going to learn a little bit about visual impairments in clients with AAC needs. When you think about access methods and accessing an AAC system, a lot of times access methods are provided to help clients with motor impairments access speech-generating devices or other AAC systems. A lot of clients with AAC needs have severe motor speech impairments, and these impairments are not limited to the speech system. Now, we also know that a lot of clients with AAC needs also have some form of a sensory impairment. So that neurological impairment may not only be limited to motor abilities, there may also be a sensory component to it. So if we think just as some examples, and I'm going to show you some examples of these, there are a number of sensory impairments that co-occur with severe communication disorders that often lead to AAC needs. This slide here shows you some examples of causes of childhood blindness that are associated with different disabilities that can result in severe communication disorders. The three most common causes of childhood blindness, retinopathy of prematurity, optic nerve hypoplasia, and cortical vision impairment, are all generally associated with either prematurity or cerebral palsy, and can have a high co-occurrence with complex communication needs. Now, with all of these conditions, they happen along a spectrum, so a person may have various levels of visual impairment, and very rarely would you find a client who's totally blind. Most of these clients will have some level of vision abilities that you can take advantage of and work with, not necessarily a total sensory impairment. So if you're used to studying speech and hearing, you know that hearing impairments happen along a spectrum, and that very few clients are actually totally deaf. Same thing happens with vision. So we're going to look at some examples, and here I have a speech-generating device, and as you can see, there's a very clear picture that you can see as an example of what normal vision would look like, and we're going to see what looking at this device would look like from the perspective of clients with different types of vision disorders, just to give you some examples and some definitions. So first, retinopathy of prematurity. This is also referred to as retrolateral fibroplasia. This condition is essentially incomplete development of the retina. So the sensory cells that pick up visual information, that sensory organ at the back of the eye, is not fully developed before birth. The retina develops from the center out. So whatever portion of the retina is not fully developed would be peripheral around the outer portion of the visual field, which could be lost or very distorted because that portion of the visual field doesn't develop. These clients may have really good central vision and be able to see very clearly within a narrow or limited field, and might actually benefit from using an AAC system with smaller symbols that they can see clearly, because those symbols are smaller and they can see the whole symbol within their visual field. Another condition would be optic nerve hypoplasia, which is incomplete development of the optic tract or optic nerve. So that nerve that carries visual information from the retina to the brain is not fully developing before birth. And whatever portion of those nerves do not fully develop sensory information that would be transmitted along those portions of the nerve is not transmitted to the brain. So this can lead to blind spots. This can lead to a number of different things, and it may vary from individual to individual and present differently in different eyes. So this example here is based on a case study. As you'll see, this client has blind spots in both eyes, but relatively has better vision in the right eye than the left eye. So this client may favor looking at things with the right eye. The third condition is cortical vision impairment, which is really quite common in clients with cerebral palsy. If you think that there's a condition that is impacting different areas of the brain, it's likely to impact cortical regions of the brain that are used for processing vision. And CVI appears to be really highly variable. We're still learning more about it, so it can be variable within an individual and across individuals. There may be a lot of inconsistency. One thing that we can say that is something you can take advantage of is that color vision or color perception is often a strength and may be preserved relative to other aspects of vision. So that color piece is something you can take advantage of. This is just a quick example of a condition you might see in some older adult patients, where a client may have macular degeneration and begin losing vision in the central visual field, which is the portion of the visual field that is used to focus and see things in detail. So that central field may be less effective or lost if there's a degeneration in the macula. And the last example, sometimes you'll see with clients who have aphasia, is that there may be a right visual field blindness called a right homonymous hemianopia, or a right visual field neglect, in which the patient is primarily or only seeing information or only processing information in their left visual field. So these are some examples, and I just wanted to give you some pictures as examples. As an SLP, you're not going to be the expert in this area, but it's helpful to have some idea of what you're dealing with, and you may get some good ideas or better understanding of what someone's vision issues are by talking to a vision specialist on your team, or an occupational therapist, or another professional who understands these issues better. And it's definitely good to consult with them. So some possible adaptations you might see. One is to make the AAC system have high visual contrast. As we said with cortical vision impairment, color perception is often preserved and is often a strength. So taking advantage of that can mean creating a really big visual contrast where the difference between colors really stands out. And this relative difference between light and dark colors of objects is easier to see. So this is an example. A really good contrast that seems to be preserved very robustly is flat black and mustard yellow. Since I did my Ph.D. work in Pittsburgh, I will take this time to say that tells me that the Steelers and the Penguins did it right. So this is one example, and it's something you may see with strength, kind of ramping up the color contrasts. Another adaptation you might see would be to implement edge lines. And you see I have a red line here on the edge of my display. Edge lines will give users some feedback so they can locate the edge of the display. This is very helpful for users who have a right neglect or hemianopia, and can be used with readings. So as you start reading along a line, you keep going until you see the the bright red line that indicates the edge of the page. And this is something that can also be implemented on communication devices. So as an example, this is a Dynavox that I saw somebody using at one point that has a red edge line on the edge of the display, so that the client could keep looking to the right until he saw that cue and knew that he had looked all the way across the screen. Okay. Another adaptation, and this is something that visual specialists use a lot, is to reduce complexity of the visual field. Reducing visual clutter around a symbol will make it stand out from a background. This is a very common teaching strategy in that teachers of children with visual impairment and vision specialists use, and it's efficacious for some conditions. The reality is that you can't always simplify the environment or the world, and reducing the number of symbols on a display limits the language potential of an AAC system. So when you're working with a TVI or a vision specialist, that TVI really needs to understand that if you reduce visual complexity, you're also at the same time reducing the language potential of the AAC system. So if you're working with somebody to address vision issues, you may want to have a conversation with them and really figure out a way to kind of balance these factors so that you're not sacrificing in one area in order to address a need in another area. Okay, and so just a couple of other examples. Auditory fishing is useful with direct selection. When you're using auditory fishing or auditory prompting, the device can be configured so it gives the user some auditory feedback as they're exploring their device with direct selection. So the first time a person selects a symbol, the device gives them an auditory cue. And in order to actually select that symbol and produce a message, they need to select the symbol twice in a row. So then the second time they select a symbol, the device produces the message that corresponds with that symbol. I also want to say that many of us have learned about visual scanning. Auditory scanning is also an option. So scanning with auditory cues that's coming from the AAC system can provide additional feedback for the user. And those cues can be provided in place of or in addition to visual cues and be used with all scanning patterns. So if somebody's a candidate for scanning, but they have a severe vision issue, they don't necessarily have to rule out the opportunity of scanning. And the same thing with auditory fishing, you don't necessarily have to rule out the opportunity for direct selection. So these are some vision issues that clients with AAC needs may encounter, some possible adaptations among many that exist in the field. And I think it's good to keep in mind that, yes, many clients with AAC needs may present with sensory concerns. That does not mean that you rule out the possibility of working with them, but you ask questions about how can I work with this person most effectively to achieve the most effective communication possible, given the additional challenges that this person may present with.